Good. Thank you very much, Javid, for sharing that session. If you look behind me, you'll see I've actually changed room from my clinic room to my rather untidy office. But it's a great pleasure to actually introduce Bruce Richmond. And really, Bruce has become part of these meetings throughout the world. And I don't think we could run it without him. And his sessions are always well received. Bruce is the founder of the Prevention Access Campaign in the United States, which really launched Undetectable Equals Untransmittable. It's now a global community-driven movement with over 1,000 official partners in over 100 countries. So that's an amazing growth in the last 5 years. And Bruce is going to give a talk today on U equals U 5 years later, how it has impacted stigma and discrimination. Bruce, over to you.
Thank you so much for having me here today to talk about U equals U 5 years later. Where are we with this global movement in terms of the reach of U equals U? How far has this campaign actually gone from grassroots to global? And what is the impact of U equals U 5 years later, really looking in terms of stigma and discrimination against people with HIV? What is the data saying, and what are people with HIV saying? So first, let's take a look at the reach of this campaign. It started with activists and a handful of researchers and has now gone from a very grassroots all the way up to the very top of the field of the most influential organizations that are endorsing U equals U. And I think it's important for everyone who's on this webinar today and beyond to know that these entities are really supporting the message of U equals U and encouraging all of us who work in the field to get this message out. So first, I'd just like to look at PEPFAR, arguably the most important entity in the global response to HIV, is requiring U equals U education of all 50 countries. I'll say that again, that is a minimum requirement of all 50 countries to educate about U equals U. And in their guidelines, PEPFAR has highlighted U equals U significantly in many sections. Here's just one of them. And they've underscored how important this message is to people with HIV into the field. They call it revolutionary. And they've also really done a great job at highlighting the importance of U equals U for reducing stigma, aligning with our treatment goals for testing and treatment uptake and adherence, and also highlighting the really important point that U equals U is a public health rationale for access to healthcare. Because when people with HIV stay healthy, we not only thrive and stay alive, but we also can't pass on HIV. And that's a really important reason to make sure that all of us have the health and the treatment and care that we need. So the WHO, this is important because a lot of people don't know about this yet. This is a recent development as of July 2021, this summer. The WHO integrated U equals U clearly into its treatment guidelines in two places, one under prevention and other under service delivery. So this is particularly important for healthcare professionals and governments that look to the WHO for guidance on if and how to communicate U equals U to their patients and to those affected by HIV. So now this is absolutely official from the WHO. We must communicate this message and we need to communicate it clearly. We have the WHO backup. But even before the update to the 2021 guidelines, the WHO made a statement along with the Health Ministry of Thailand and UNAIDS supporting U equals U unequivocally. They actually said that they endorse U equals U and they were encouraging people to raise awareness and promote knowledge of U equals U, underscoring the benefits of this to reduce stigma and its alignment with our treatment goals. So again, it's really important that WHO is behind us and that everybody know that. And then I want to give a huge shout out to Brazil, one of the first countries in the world to officially integrate U equals U or I equals I into their treatment guidelines. So this was back in 2019. Shortly after that, the United States integrated U equals U into its official treatment guidelines, and the CDC released a statement strongly encouraging the field to communicate the U equals U science. Now, the CDC had already agreed with the science back in 2017, but this was the first time that they issued a really strong statement to the field that it's time to communicate this message, and you can use the U equals U phrase and terminology, and you should. More recently, Japan signed on and endorsed the U equals U message and integrated it as part of their treatment guidelines. So it's really important to see this. Now let's look at the impact and how this is affecting stigma. I think it's really important for us to recognize that stigma is still here. There's a lot of research about how bad stigma is in this field. People are really suffering, and here's some recent research that shows it's pretty shocking how severe the stigma still is in the public and the perceptions of people with HIV. So here's a study from Terence Higgins Trust in the UK showing 38% of people were uncomfortable just going on a date with someone who is positive, and nearly 50% would be uncomfortable kissing someone who is positive. This is a study from GLAAD in the United States showing that 59% of people said that it's important just to be careful being around people with HIV, and half would feel uncomfortable having a spouse or a partner living with HIV. Here's a study that we did called Owning HIV that was also really shocking because we were looking at young folks, and we thought that young people in the United States would be more open-minded, perhaps, but we found out that they really weren't being well informed about HIV in the United States, and 28% have said they've avoided hugging, talking to, or even being friends with someone who has HIV. 30% said they would prefer not to interact socially with someone with HIV. These are young adults in the United States. This is shocking. This is really disturbing. But U equals U is working. The data is showing that it is working. Women living with HIV, a study from the Well Project in the United States showed that 72% felt that it had a significant or tremendously positive impact on their lives. A study by Jonathan Randina showed that in the United States showed that 82% made them feel at least a little bit better, and 80%, close to 80%, said that it would have a positive impact on societal stigma, the perceptions of people with HIV. And in South Africa, a recent study shows that it is reducing anxiety associated with testing and the stigma associated with testing for HIV. More people, men in South Africa, were coming in to get tested for HIV when they learned U equals U in advance. So that's really exciting. So this is what some of the data is showing, and there's more and more data coming out, but at this point, there's not that much on how is U equals U impacting stigma. We have a lot of research on how bad stigma is. So what we want to see is more research on what works and to go deeper into solutions. But I really love listening to the voices of people living with HIV, because this is where we know that it is really helping people from all parts of the world. Cheryl from the Seychelles says that she's ready to break free and live and love without fear of discrimination. She's so excited and enthusiastic about this and has so much to look forward to in life because of U equals U. Similarly, Catherine from Zambia said she has a more positive feeling about herself. She doesn't feel like a danger to anyone. That's what we hear so often, is that people feel dangerous to the people that they love or want to have sex with or have a child with. They feel dangerous. Now we don't feel dangerous anymore. And Pete in Thailand, in his words, says that U equals U brought light in his darkest hours, and he keeps learning about it and feeling better about his life, and it makes him feel more valuable. And Daniel in Colombia, he kept hearing, as I did in the early days of this campaign, that U equals U just reduces or undetectable viral load makes it a smaller risk, transmission risk, or there's still a little bit of risk, and that's a heavy load to bear. But learning that there's no risk when you're undetectable and you're on treatment, that changes everything for us. That's why it's so important to be clear in our messaging. And Claire, who is from Rwanda and living in the United States, her babies are her U equals U babies. She conceived 2 children with her partner after she learned about U equals U. That's such a beautiful thing. Also, a really important, probably the most important study of this campaign recently came out called Positive Perspectives Wave 2. Really important study from ViiV Healthcare. I was very fortunate to be involved with it. One of the largest patient-reported outcome studies to date showed that when people with HIV were informed by their healthcare providers about U equals U, they were reporting significantly greater sexual health, mental health, overall health, viral suppression, comfort sharing their status, and adherence. So this shows how it's important for healthcare providers to inform people living with HIV because of the positive personal outcomes that can really be effective and change tremendously by hearing about this message. So it's important for everyone who interacts with people living with HIV to share this message. It's important for our health, and it's also important for public health, because the more people with HIV who are on treatment and healthy, the fewer new transmissions there'll be, and that'll get us closer to ending the epidemic. So together, let's work towards ending HIV stigma and discrimination. And here are 3 ways that everyone who's on this webinar today and beyond can help take a part in this and really change what it means to live and love with HIV around the world. First, we need to integrate U equals U into policies, the guidelines, laws like criminalization laws, and communications. And I just showed some great examples from Brazil, the United States, and Japan about how country guidelines are changing to incorporate U equals U. People need to hear from the very top so that they have the comfort and the credibility to share U equals U. It's still new information. It's still scary for a lot of people to share this news because it's so radical from what we've known for decades about transmission and people with HIV. So it's important to hear it from the top. And second, we need to have opportunities to educate and to talk about U equals U among healthcares and all professionals, and also in the community like we're doing today. So again, a big shout out to Virology Education for having this today, encouraging this discussion, and for everyone who's listening now, because this is how we're going to end stigma and discrimination, by talking about U equals U, training people how to talk about it, and continuing that dialogue in the field and in the community. And finally, to promote U equals U and all of your health communications with people in the field and outside the field. And we have to be clear. We have to be very clear in our language. We have to be consistent. We got to repeat the messaging over and over again. Because it's new, it takes a bit of time for it to be accepted by folks. So we got to keep repeating the message in different ways and make sure that it's conscious and it's authentic in the communication and adaptable to local contexts. Like we saw in Venezuela with the Guararo tribe, the oldest indigenous tribe in Venezuela, has a M equals M program. So it needs to be culturally adapted and sensitive, that not all people can get to an undetectable viral load, and we need to use U equals U to lift everyone up, to make sure that we all have the option to get the treatment, the care, and the services that we need to benefit from U equals U. That will improve our lives and reduce new transmissions, bringing us closer to the end of the epidemic. So a big thank you to everyone who's here today. Again, to Virology Education, to the sponsor ViiV Healthcare, has been tremendous at sponsoring these kinds of educational opportunities, research, and programs around the world. And a major shout out to all the organizations in Latin America that are committed to making the U equals U, the I equals I, the M equals M, or message widely known. These are just a few examples. There's so many more. I know you'll hear more about them today. Thank you so much for listening. We really appreciate you being committed to sharing this message. We are changing what it means to live and love with HIV around the world. Thank you.
Thanks very much, Bruce. Bruce is actually joining us from Lisbon. I believe he's in an airport and has to get on a plane. So we're going to stick to 30 minutes, otherwise he misses his plane. please ask questions on the chat, but also it's great to welcome two panelists who are going to discuss Bruce's talk and other aspects of You Equals You. I'm joined by Erica Castellanos, who's a transgender woman living with HIV. She's from Belize, but presently resides in Netherlands, where she's the director of programs at GATE and a board member for the communities delegation to the board of the Global Fund. And also by Franco Bova, who's an activist who actively works on spreading the You Equals You message in Argentina. He's a medical doctor, a teacher at the University of Buenos Aires, and coordinator of the integral health area of Asociación Ciclo Positivo. Sorry about my terrible pronunciation. So let me start by asking you, because Bruce, that's a great talk, and there seems to be an emphasis on You Equals You changing internal stigma. You know, people living with HIV are a lot happier, but much less of an impact perhaps on external stigma. So I'd like to ask all of you, how do we actually get this message across? I know, it's been on buses in England, it's been on posters, but getting the message across not only to the general population, but to the medical population as well. So perhaps I'll start with you, Franco. I mean, a recent survey in London, in East London, showed that, medical staff, not staff working in sexual health, but medical staff, no idea about You Equals You. So if the medical staff have no idea, how do we get it across to the general population? So I will say before Franco answers, is that it's a kind of mixed language between English and Spanish, I think. So you'll hear different languages being used. So Franco, do you want to start?
Hola, ¿qué tal? Muy buenas tardes.
Hello, everybody. Good afternoon or good evening, depending on where you are. I would like to thank for the invitation and the participation. I believe it is very important. And I also want to thank the fact that I can speak in my own language because of sovereignty reasons. Now, to the point, I believe it is essential to celebrate 5 years from the campaign of You Equals You, how the different initiatives at organizational levels, at civil society in different worlds, has the protagonist many times, as is the case that we want to bring here from my organization, the young voices as the essential voices for the full promotion of this campaign. It is true what has just been said about the fact that health professionals and health teams and health services are a key sector to commit and involve in this campaign, because we cannot think that this campaign will be able to overcome discrimination if the message is contradicted. If you read from these organizations, for that reason, we are stating here that as long as we get data, for example, in our country, we are dealing with good research to see what is going on with treating physicians of people who live with HIV, and we have to see if they agree with this, the level of agreement, if they select or decide to share this information with their patients or not. And during this research, in parallel, we are trying to have a federal framework, federal research in Argentina and different provinces to contact different health centers to provide training in this field and awareness as well among the activists, health services, and governments, the ones who are responsible for this information. We are trying to build a response, as Bruce just said, to include You Equals You as part of the title. We cannot leave You Equals You outside the communication.
Great. Bruce, let's come to you and your thoughts about how you've been great at getting the message across amongst the those living with HIV or those working with HIV. How do we actually move it forward, though, and get the message effectively over to the general population, to the young. None of us are born with stigma. It's something that we learn, getting in early about you equals you. What's your views on the next steps forward? You're on mute, Bruce.
Okay, can you hear me okay now? Okay, great. I wasn't able to hear what Franco said because I don't have the translation, but I always agree with everything he says. So I'm sorry if I'm redundant. But I think in terms of getting out to the general population, I can give you some great examples. In Vietnam, the CDC and the Positive People's Group and the Health Ministry did press conferences in the north and the south of Vietnam just on U equals U to educate journalists and make sure they are getting the message out. They had doctors and people with HIV on national television. So they actually hired PR firms to do this. They had Miss Vietnam speaking about U equals U, or K equals K, I'm sorry, all over the country. They had events, they had fashion shows, they were on game shows. So this shows a real commitment from leadership from the top down. We're also seeing that in England, where Terence Higgins Trust and British HIV Association work with Gareth Thomas to get this on the BBC and get this message out, can't pass it on. So what it's going to take is the big agencies that have funding, as well as governments that have funding, to make it a priority. In my own country, I'm sad to say, hasn't really made it a priority yet, but we hope that this year that we're going to see that. We're going to see them taking as much interest in getting this message of U equals U out to the public so that we can end the stigma, because the public really doesn't know. So we need to engage journalists. We need to engage popular people in popular culture, celebrities, influencers on social media. And the reality is, it's not that hard to engage them, because once you tell someone who has influence, they're shocked. They had no idea. And often they do want to share that with other people. And that's one of the ways that we are going to get this out to the public is national campaigns like Terence Higgins Trust, engaging journalists. And by the Terence Higgins Trust campaign, it's called Can't Pass It On. Engaging journalists, engaging popular culture folks, and social media influencers to keep getting it out, repeatedly getting the message out.
Right. Erica, do you want to comment on that? Otherwise, I've got a question for you.
I totally agree with what Franco and Bruce has shared, and I think we all have a role to play, and defining those roles that we play from each of the sectors that we are involved in, parliamentarians, healthcare providers, the community, everyone has a role to play, and everyone is equally responsible.
Great. So let me come to you, Erica. So what does U equals U mean, I suppose, to you and also to the trans community? When we ran this workshop in Asia, the trans community had a lot of separate issues with dealing with stigma. And what does U equals U? Part of the thing we need to look at, I think, is how we get the message into different communities and the effect of U equals U in different communities. So if we take the trans community, what's been the effect there and how have you got the message across?
Voy a empezar hablando en español primeramente un poco.
I will switch into English first. I would like to share with you one of these things. From my point of view and from my personal experience, U equals U. Well, for a trans person living with HIV, what this means for me, I was diagnosed in 1995, so many, many years ago. When Lidise was speaking at the beginning about this event, and she was talking about using disposable dishes, this reminded me back in the times when I was discriminated in hospitals back at that time. And having lived all that back at that time, all this path, it was such a big stigma being a trans woman living with HIV, and your family members were recommended not to use the same plates. They had people sleeping outside our homes. This was a real disaster. So this message has meant freedom for me, the freedom to have information, to feel I have the control on my health and on my decisions. This has moved away this fear, this blame this. This was not born in me. This was institutionalized by the service providers who said, be careful, you can transmit your disease to somebody else. And this refers to what Bruce was saying. Bruce shared what this person was saying. The person said that she felt relieved and she felt freedom. She was not any danger any longer. And this is what we feel. But mainly, this gives us a chance to be able to feel and to decide, feeling empowered. I can decide how to live my life, how to live my sex. I am not just a vector of the virus and that everybody has to feel afraid of me. To have a healthy, full life, this is meant to feel happy, be married, have a family with 2 children. And now I'm not any worried any longer. My family has the necessary information in order not to have any concern about this. I will switch back into English now.
Community, I think there's one major important thing that we can say it's impacting the trans community. As you mentioned, in other parts of the world, it's not only in Asia, everywhere in the world, even in places, some people think it's the haven places for trans people face a lot of discrimination. European countries sterilize trans people in order for them to get a legal gender recognition. Trans people are criminalized, sent to jail, and they're chased away from school, from their homes. They cannot access education. They cannot access the job market. Trans people, in many countries, are not able to vote because because of issues around legal gender recognition. I can name any problem you can think of, and we are facing it as a community. But one radical change that U equals U brings to us is that we are no longer seen as that statistic that is the vector of a disease that is only shown in reports, and our names, trans people, is only shown in reports related to HIV. We are much more than a statistics and a number. We are human beings with rights, with autonomous lives, with dreams of a future, of healthy lives, of having families. And it's important to note that it's so welcoming that we have to deal with all this other bullshit still, but we can remove the issues around the transmission of HIV and all the stigma that is associated to it. I also want to share, it's not only for the trans community, but it's in general. I have many times talked to many people, politicians, healthcare providers, and they tell me bluntly on my face, U equals U is about sex. You just want to be able to have sex without a condom with everyone, anywhere. Let me tell you what I answer to that. It is not about sex only. For some of us, it's not about sex at all. It's about the freedom of choice. It's about the empowerment that it brings us. It's about removing all that stigma and discrimination that has been placed upon us by others. And it has been crammed so much into our heads that finally we accept it and we live with it. But if it was about sex, so what? If it was about sex, then whose problem is it? The problem with HIV is that it's always been demonized because of sexuality and sexual encounters and sexual risks and sexual practices. Nobody should care who I have sex with or how I have sex as long as I am safe. So politicians should not legislate based on how I want to have sex, but based on making sure that I can have sex and I can be safe while having sex, whichever way I want. With one, with two, with 10, with or without condoms, it doesn't matter.
Well said, well said. I'm actually going to ask the other two about that, because that was another question that came through. What about this idea of risk compensation? Part of the question about U equals U, people have turned it on its head, as Erica has said. Say there's going to be more sex. People won't always be undetectable. There'll be more transmissions because there's more sex, more sexually transmitted infections. How do we deal with that? Erica's given us her view. What about your view, Franco and Bruce? Let's start with Franco again.
Yo creo que algo que es muy importante.
I believe that something that is very important that we started discussing is there's no risk balance here. Information could never be a risk to people. This campaign, the goal is to promote what Erica just explained perfectly well. The fact that people with HIV are not dangerous at all. People with HIV can have access to their treatment and they can keep the you cannot transmit the disease by sexual means. This information will never be able to be dangerous. This information changes the lives of the people. This information makes the people to, as we just said in the previous presentations, to have less fear, to have a diagnosis, to have a reason to tolerate and sustain and maintain the treatment, keep the treatment. HIV is not a cure today, and we have treatment. You have to go and get the drugs or the medicine, knowing that you have HIV. For others, should not be a problem. All these situations do not have a policy that is supporting the situation. Today, we have the possibility to promote this information of all the things we just discussed. People with HIV should not be perceived as dangerous, and people having HIV or not may lead a normal life. A clear message, important activism, and can promote information of public health in a different way, different from what has been done. There's no risk balance. Nobody's saying that U equals U means that people stop using a condom. Quite on the contrary, we are saying here that something that is very local in Argentina, U equals U campaign just goes with French fries, goes up with French fries. What we mean by this is U equals U can be freely promoted. We promote the use of condom if people want to use it. This is not excluding, it's not excluding factor. What is the excluding factor is not to talk about this. Those who had access to this information because we are in a privileged position or situation, and those who can contribute to reducing stigma and discrimination. If this is not fully promoted, this creates injustice. So this should not be a privilege for a person with HIV is not transmitting the virus. All people should be involved in full promotion of this information.
Yeah, I think what you both say is very sensible and very real. And I read something just the other day that, people don't talk about the dangers of increased sex with contraception or with erectile dysfunction drugs, but they continue. I think Erica put it nicely. HIV is this sexual disease, and it's something we need to get away from. But Bruce, what about your view on this?
Well, I'm sorry again if I'm repeating some stuff. I mean, I think first of all, whether or not someone can pass on or acquire an STI has nothing to do with whether or not we should inform people about U equals U. It's holding one disease hostage for another. So there's no ethical or medical justification to withhold this. So that idea of risk compensation is just unreasonable and unethical and is taking away bodily autonomy from people with HIV. And then second, it's about education. I mean, we do talk about, having an undetectable viral load only prevents the transmission of HIV, not other STIs. So you might want to, or pregnancy. So you might want to consider condoms for that, as well as if you are unsure of your partner's status. Then the third issue of whether or not people are going to know they're undetectable or think they're undetectable when they're not, well, that's just education. And that comes from stigmatization of people with HIV, that we're irresponsible and that we can't learn. But we can learn if you teach us. Actually, U equals U is not that complicated. When we do our communications training, if you hear someone says it's too many nuances, it's too complicated, it's because they're afraid of it and they don't want to say it. And then finally, I would say that in terms of dealing with people in countries and cultures that are really just not going to change their attitudes about sex, I mean, I want to ask them, do you use condoms with your partner? So why are you making it a point to judge us and try to restrict us? But what we do is we take the conversation, as Erica said earlier, away from sex. So we don't talk about sex. We talk about conception and babies, and we try to get into their mind about family and how important family is. And we say things like people with HIV are being told that they can't conceive children. So that's one thing we say. Then we also focus on the public health argument that, if you do this, if you tell people U equals U, that will stop new transmissions. So there's ways to get around that sex negativity and that judgment and that control of the bodies of people with HIV that has been going on too long.
So Bruce, I'll stay with you. So just because then you haven't been repeating everyone, so don't worry, but so that you get the first, and then people can talk about, what about how U equals U has helped or advanced attitudes to HIV criminalization?
Well, I think that's a really complex issue because there are a couple different points. I mean, we've seen, tremendous progress in the United States with reforming laws, some significant progress, some a step forward, as well as in Canada and France and other places in the world. It's a really important part of the decriminalization toolbox. But I think the complex issue that we've talked about with our CRIM partners is that if you remove the penalties for non-disclosure when someone is undetectable, but you leave those penalties when someone has a detectable virus, then what we're really doing is further stigmatizing and marginalizing folks that are struggling to get to undetectable or choose not to get to undetectable. And the point is that we need to reform these laws across the board. They're not helpful. They're bad for public health, and they're unjust. So they should be taken off, and we could be focusing more on something like intent to transmit or actual transmission with intent to transmit, not simply whether or not someone disclosed their status. We need to reduce the penalties as we're seeing, and we're seeing penalties getting reduced from felonies to misdemeanors. So it's less harsh penalties, and we're seeing the laws written right off the books because of the new science of U equals U. But again, it's complex. And I would talk to, there's a lot of good CRIM folks out there that are working on it.
Erica, do you have any experience of U equals U and criminalization?
Just 3 short points to share here. Many states have the utopian thinking that withholding the U equals U message will prevent people from having more sex. That is not true. We will continue having sex regardless if you share the U equals U message or not. HIV criminalization laws are not based on science. Let's face that fact. It's based on fear, and it's based in controlling people's sexual life and what happens in their bedrooms. That's unacceptable. One more thing, accepting the U equals message is not something so easy. That's why many countries have such a hard time to accept it. It comes with responsibility, because then it means you need to take ownership of that message, make sure you provide the treatment for people to be undetectable and be able to enjoy the benefits of U equals U. And that is what is preventing governments from really enforcing and accepting the message.
Thanks. Franco, there's a question for you. What would you say, or indeed do you say, to other young people who are not yet convinced by U equals U or do not want to work towards forwarding this campaign?
Bien, yo creo que es un poco.
I think this has to do with starting with the fact that if there's a person, youth in general, I think they're the main allies in this campaign. I think we, the young people, are always tired many times of them telling us what to do with our lives, to look at us as if we were the future of society, but there's a bunch of barriers and difficulties to be able to achieve our dreams. And specifically, those of us who belong to diversity, etc. Within this context, I think that this campaign is very seducing for young people. I think it's very important because it brings us into the present. In 40 years of HIV epidemic, You equals you allows us to build up a campaign. In Argentina, as a matter of fact, all of us who are working very hard to be able to spread all this within the provinces. We're all young. The first people that are interested in this are university or student bodies or people who work within communities. The youth understands that this is not the future. It's the present. It's today. And the present we want to live in is where we have a right to more freedom. When we talk about you equals you, we're talking about all that. And this is also a way to build the present that we have. So if there are young people who are not involved today, it's because they haven't been called to do that. They are our key allies. And it's not only the future, but also the present for this campaign and possibly the possibility of this to be successful in different countries in Latin America.
Bruce, I think you want to make a comment here as well.
On the question from the audience?
Yep.
Oh, yeah, I just informed is, when the people find out they're undetectable, they relax and they don't take their medication and they spread HIV. I've heard that question quite a bit, especially in lower income countries where the colonialism is ripe, where you think that people with HIV can't understand. Here's the deal. Medicine works if you take it. Just explain to folks, take your medication as prescribed. You can stay healthy and enjoy life without passing on HIV. If we assume that they're going to stop taking their medication, and so we don't tell them you equals you, that is an act of violence against human beings. And what will happen is they'll find out elsewhere. What we're seeing is doctors are saying exactly what that comment was, which is an important comment, and the doctors are not telling people you equals you. And then their patients are finding out elsewhere from their friends or from social media, going back to their doctors, and that trust is forever broken. And then those doctors start getting bad reputations among people with HIV because that doctor withheld it. So the thing is education. People with HIV can learn. If you take the time to teach us in different learning styles, make sure it's culturally appropriate kind of language, we can learn. It's important to get the message out. There's no reason to withhold it because we're afraid that people might not be able to understand and follow the guidelines.
Here's an interesting question. Short answer, though, because we're running out of time. What do we do about you equals you if we're in countries or areas where you can't measure viral load? Anyone want to answer that one?
Very shortly from my part. I lived in a country that didn't have viral loads at the beginning, and it was through the community advocacy that we got viral loads in the country. Here we have a huge tool. U equals U is a tool that we can use as an advocacy tool to demand viral loads in the country and hold our governments accountable to implement a U equals U message in the country. So use it as a tool.
And I think also, if you can get the message across, it's going to drive adherence, isn't it, as well? And I think one thing is we forget, but I think Bruce or someone said, people living with HIV are fearful of infecting other people, and if you get the message of U equals U across, it's going to drive adherence. So look, we've got a very short time left. So I like at the end of these to actually ask each of you for one take-home message for the audience. So let's start with Erica first. One take-home message for the audience.
I would say HIV transmission is not only the responsibility of people living with HIV, and U equals U is a powerful tool that you can use in your countries.
Great. Franco, for you, take-home message.
Mensaje claro.
Clear message, yes, of course. I wanted to call upon the youth everywhere who's listening in to please join us and to build and form part of the messages of this alliance against stigma and discrimination that undetectable and untransmissible is all they have to do is get together, think how, and start spreading the information wherever they can. They can, you can too. It doesn't matter, there's some things you don't know. We learn on the way.
Great. And Bruce, take-home message for you. And I'd just like you also just to say what's next. Okay, U equals U's 5 years old. You know, what are you going to do next with this message?
Well, the quick take-home message is World AIDS Day is coming up. So this is a perfect opportunity to integrate U equals U into any of your statements. It fits into like pretty much every topic in the field. Email me if you want some help with your speeches. We want to see it in every speech this World AIDS Day because too many people don't know, and it's up to all of us to get that message out. In terms of the next phase of the U equals U movement and prevention access campaign, you know, now that U equals U is confirmed by science, it's now I think today we reached the 105th country. So there are activists in every single continent. In some places, there's one person living with HIV who is working hard to push their government and healthcare providers to start saying it. So what we're doing now is we're organizing as U equals U community leaders to work with PEPFAR and UNAIDS and all these other global influencers who can have an impact on governments and say, look, it's in the PEPFAR guidelines. You've got to get this message out. And we will enforce it. You've got to get this out. And people living with HIV are continuing to lead the change of the U equals U movement globally. We're making sure this message gets out, integrated into guidelines, public health communications, and in our global advocacy for treatment, access, and viral load testing, as Erica mentioned earlier.
Great. Now, look, we've come to the end. So I'd like to thank you all for a fantastic session. Bruce, fantastic talk. For the audience, we're now going to have a short break. And then after that short break, we're going to move forward with the next session, which is on stigma and discrimination in times of pandemic. I'd like to thank you all for the great first part of this symposium. And I look forward to joining you for the next part. Thank you very much.